Good evening. I'm Dr. Sitalakshmi. I'm dermatocosmetologist from Ojas Aesthetic at Madhapur in Hyderabad. Today, I'll be highlighting on Botox treatments other than the facial muscles. They know that we use Botox very often in and out in our OP to beautify a person. There are also other indications, lesser known indications of Botox, and these have to also be considered because these are useful for the client and also very easy to be administered. Botox is used as a lyophilized powder, and this is diluted in the clinic at a specific dilution. And these injections are given with a hypodermic needle, the 30 gauge, and they are very much less painful. So there's not much downtime, and it can be done as an OP procedure. The other indications where we give Botox mostly are, you must have seen that many people have profuse sweating. It could be either the underarm sweating or sweating in the palms or sweating in the soles also. We have encountered many small and young individuals, and most of the time we think that it's a neurogenic disorder. Yes, it is a neurogenic disorder. Apart from their anxiety, there is also certain neurological syndromes where there is excessive sweating from in the body. This excessive sweating is not only embarrassing, sometimes it can also combine with the hidradenitis suppurativa, giving very foul smell to the sweat on the underarms. So this becomes embarrassing, especially when they're working and when they're talking to individuals or meeting a person becomes very, very embarrassing to such a level that they become socially inactive. So in these conditions, the Botox is used as a very important tool. The other forms of treatments are also available, but they are more cumbersome and more prolonged. Though Botox is little bit can be used as an immediate measure, it's a temporary measure and it has to be repeated again and again. But it gives considerable happiness to the client as there is immediate change within 48 hours. So the heavily sweating areas are mapped either through iodine and starch so that we can use exactly where the sweating is heavy. And Botox is given in the form of 0.1 to 0.2 or even 0.3 units per area, and it causes the blockage of the nerves, sweat gland nerves. Therefore, the sweating calms down drastically. Similarly, some people are very much embarrassed to shake hands because they always sweat a lot, and meeting people or holding some things becomes difficult. I have seen a very young client, a student who could not even hold the pen because of his excessive sweating in the hands, and he has to carry a big towel to always wipe his hands to do small activities. So this becomes much more troublesome as they evolve in their life, and this also becomes socially an embarrassment, and they may lead to other psychological syndromes. So correction of these disorders, though temporary, is very useful for the client. In the similar way, the mapping is done and the sweating is seen. And here I can also show you a video where we are doing the hyperhidrosis of the arms. The client also has hyperhidrosis of the feet, where there is excessive sweating in the feet, and the socks which she wears is drenched with sweat within few minutes. Therefore, their step becomes slippery. They may often fall, and this leads to other injuries. Therefore, the mapping of the areas is done in the clinic. Sometimes it's slightly painful to give these injections in the soles or the palms. Therefore, we can use a digital block so that it is completely blocked and numb. And then we can administer the Botox in the form of 1 unit or less than 1 unit in small boxes. And this causes temporary relief to the sweating, may be prolonged up to 3 months to 4 months. So the patient is happy for these months, and it can be repeated often. Similarly, Botox is also used for other indications like dystonia of the neck, as I told before. It was also used for certain cervical dystocia. It's also used for twitchings in the neck or in the eye. It's also used in bladder dysfunction, that is incontinence due to bladder dysfunction. So it's mostly used in other settings like neurologists or gynecologists. So many people are not aware of this, but this can also be used in bladder incontinence. Very rarely It's also used in vulvar dystrophies. That is there is a condition where this is called vaginismus, and this can lead to frigidity and infertility. Therefore, it can also be used in this condition. Of course, prior counseling and exact diagnosis is important here and can be used to prevent vaginismus. So, Botox overall has many functions and can be used in many fields, and in the cosmetic field, it's a valuable tool. Therefore, I feel that many people have to experience the Botox. If you say money can't buy happiness, I say try Botox. You will instantly feel happy. Thank you.